Hello and welcome to this month's Simon Says Expert series. I'm Calvin Roberson, Director of Operations for the Cancer Center Office of Community Outreach and Engagement. I hold dual master degrees in Master of Health Administration as well as Public Health, and I've had an opportunity to design research studies as part of my practice. In community outreach and engagement, we use evidence-based strategies to help people prevent disease from occurring and help people get needed cancer screenings so the disease can be diagnosed early. In May, in Indy, and at the Cancer Center, we believe in the race to prevent cancer, early detection, and prevention win. Americans are increasingly being diagnosed with cancer, with some populations experiencing diagnosis at younger ages. But we know a substantial proportion of cancers could be prevented because advancement in cancer detection, cancer prevention, and cancer treatment are happening at a record pace. Joining us today to share her expertise is my esteemed colleague, Mary Robertson. She is the Prevention and Screening Lead with the Office of Community Outreach and Engagement, most recently the Director of the Indiana Cancer Consortium. Mary is dedicated to improving the health of all Hoosiers. Thank you, Mary, for joining us today.
Thank you. We're going to go ahead and get started and try to make this a little bit more conversational. So Calvin and I may have some more back and forth, but we're going to go ahead and get our slides up and then we will dive in.
Absolutely. So just to start out, can you just give us an overall view of what's happening in the state of Indiana with the cancer burden and which cancers are most prevalent and who is most impacted by cancer here in our state?
Yeah, unfortunately, like many other diseases, we are not doing well in Indiana. We have a lot of work to do when it comes to cancer. So you can see that the data that we have here, just comparing Indiana to the whole United States, we do have a higher incidence rate, so those being diagnosed with cancer, and also a mortality rate, so those dying from cancer, as well as some of the top cancers, which we'll get into in the next couple slides, also reflect the same. So we have the same challenges as the whole United States, just a little bit at a higher rate. And then as you can see here is our top cancers people are being diagnosed with. So again, you can see those red being the Indiana numbers, but for breast, prostate, lung, colon and rectum, and corpus and uterus, as well as some other HPV-associated cancers, are really the top that we're facing. And unfortunately, with cancer being so common, 2 out of 5 people in Indiana are going to experience cancer in their lifetime. And thinking about your family, your colleagues, it's really unlikely that you're not going to know someone that's going to be diagnosed or being diagnosed yourself. So really, we all have a stake in the cause. And then when we look at where are people living in Indiana, what populations are affected more, Calvin said that well in the intro, we're seeing some populations affected at larger rates, whether that's being diagnosed at higher rates or unfortunately dying from the disease at higher rates. You can see that those red boxes are rural, with our lighter red being urban, and then our higher density population of our African American populations being in those central blue box, and then the top left blue box. So unfortunately, we see a lot of cancers affect populations at higher rates, and African Americans in Indiana is one of those populations. And so as we talk through some cancers, we'll address that more.
And if you don't mind, I'd like to go back to the last slide. We had talked about that we have this concept of prevention, and prevention usually means it can stop or greatly reduce the likelihood or chance of a cancer coming on, or screening really looks at early detection, to what extent we can catch the cancer early enough to prevent mortality. Are all of the top cancer do they fall within this category of both prevention and screening? And if not, can you identify which ones are rich?
Yeah, so we do have screening for breast, prostate, lung, cervical, and some head and neck as well. And then for corpus and uterus, we don't have exact screening at this time, but that doesn't mean we won't in the future. And on the prevention side, we know strategies that can specifically help prevent all of these cancers individually. So some we'll go across the board, and then we can look at, cancers like colorectal cancer that have even more specific strategies to prevent that type of cancer. So there is definitely something we can do across the board for prevention and screening for our top cancers.
Wonderful. Well, thank you for sharing that. Now, I noticed that breast cancer is the top of incidence, but it's not the top of mortality. Can you share a little bit more about what's going on with breast cancer, what it is, what are some of the risks, and what can community members do to help detect breast cancer early?
Absolutely. Yeah, as you said, it's one of our top cancers, and unfortunately, the second leading cause of death for females. So as many people are probably aware, more common in females, but males can get breast cancer as well. So I always like to put that on folks' radar. It's very important to know your body, trust yourself, especially for males who screening is not recommended for. And so what we're seeing is we have a screening mechanism, which is mammograms, and that's recommended to start at age 40. So one of the reasons we have really high incidence rates is because we have a really great, accurate screening mechanism. And in our society, I think we've done a really great job of raising awareness for breast cancer, especially during October. You're seeing lots of pink. I think we've done a great job of educating the public and also working with our health systems to be able to screen more patients. And so that's why we're having some of those higher incidence rates. While we're seeing the gap between incidence rates and then those that are dying from the disease, is we have some gaps in care there. And that can be due to a lot of reasons, whether it's the patient's personal social determinants of health, whether that be cost or access, or a gap in our health system of doing that follow-up from those being diagnosed to getting into treatment and fulfilling their treatment as well. So that can explain some of the disparities we're seeing in incidence and mortality. But when it comes to the risk factors, that's really, really important, especially when we're talking about screening. So throughout this talk today, you'll probably hear Calvin and I say family history a million times. I don't think I can overemphasize it. Your personal family history, along with your other risk factors, absolutely change when you should get screened. So getting your mammogram at age 40, that's the general recommendation if you're what we call an average risk individual. You don't have a ton of these risk factors. Now, if you have a family history, it's really important to collect that for all the cancers. And those can be difficult conversations sometimes. Sometimes you just know, grandma was sick and passed away a month later. So it's really important to have those conversations for your grandparents, your parents, your siblings, and your children are the most important to learn their history of cancer. And then, so especially for that, you might have a lower screening age that you should get starting at, depending on how your doctor reviews that family history and makes that recommendation. Then in terms of race, we've touched on it a little bit, but we've seen, especially for African-American women in Indiana and nationally, that they're getting diagnosed at the same rates as other large populations, such as white individuals in Indiana. However, what we're seeing is they are dying of higher mortality rates, and that's due to multifactorial, complex reasons, but we have been able to hone in on a few of those, like the social determinants of health that I previously mentioned. But they're also at higher risk statistically for some of the other risk factors, such as the other diseases like obesity and diabetes, which are risk factors for several cancers. But in terms of other risk factors, so there's some reproductive factors. If you have a long history of your menstrual cycle, so you started at a younger age than average, that's an increased risk as well. And then certain medical findings, such as having dense breast tissue, that will also change your screening recommendations most likely. And then those that have been on menopausal hormone therapy, the combination as well, just a slightly increased risk.
Wonderful. Thank you for sharing that with us. Now, one of the questions that had appeared in the chat was, are we doing anything as a Office Community Outreach and Engagement to address breast cancer? And so I'll let you take the lead and then share about the Breast Health Disparities Collaborative.
Yes, absolutely. So we're trying to do everything we can across the board for cancer, specifically for breast cancer, really raising awareness about mammograms, the availability, how they can get them. And so one initiative that we have is to partner with the mobile mammography units throughout the state. And so we try to partner with a community partner to host an event and have the mammography van right there, getting people signed up in advance, and really going to them, meeting them where they are in the community. And so that's been really successful with a couple partners throughout the state. And if our state could have 1 million mammography or mobile units, we could do even more work. But that's just one effort we've seen to try to increase the screening rate.
Wonderful. Thank you for sharing that. For those who may not be aware, we also partner with the Indiana Health Disparities Collaborative, which is a composite of a variety of nonprofit agencies that provide social support to African American women who have been faced with breast health challenges, as well as the major healthcare systems who have really agreed to band together to do a warm handoff. And so as issues or challenges are provided or are made known, we can reach out and go to the right person at the within whatever system, a nonprofit, to get them connected to the resources they need, and whether it's additional screening, whether it's financial aid, whether it's housing support, whether it's food support, whether it is just some other basic needs that's non-clinical as well as clinical. It is really geared towards really helping to uphold Black women in their journey to prevent secondarily or tertiarily the occurrence of either breast cancer or other cancer. And part of what we're also doing is exploring prevention and being able to get out into the community to uplift what community members can do to help safeguard their health and well-being, particularly their breast health. So just wanted to share that as we continue the conversation. Now, another one that's pretty big is colorectal cancer. And can you give just, again, an overview about what the colorectal cancer is and what's happening here in Indiana, and what are some of the risk factors or ways that we can, again, treat or discover it?
Yes, colorectal cancer is probably one of the cancers I would say has been in the news more often in the last several years. We've seen several celebrities, unfortunately, get diagnosed or die from the disease, which has brought a lot of attention. And, for the reason that matches the statistics. It is very common. It's the third most common cancer diagnosed and is usually toggles between our top 3 to 4 cancer mortalities as well. And so the largest risk factors for this cancer specifically is race, and tobacco use also has a huge impact as well. So a lot of these risk factors are common across the cancers, but they just apply a little bit differently. So again, we're seeing for colorectal cancer that African Americans are diagnosed at higher rates and younger rates. So we do think there is a genetic component to that that's being researched as well. But again, that family history is very, very important. It actually determines your screening options. So unlike breast cancer and some of the other cancers, there's multiple screening options, which I'll address next. Age is also very important. So we're seeing that this cancer has gotten younger as well. So the recommendation has changed to age 45 to begin screening. And so again, if you have that family history, they actually recommend that your family member, the age they were diagnosed, you start screening 10 years younger. So if you had a family member diagnosed at age 49, they actually want you to start screening at 39. So again, very critical about knowing your family history, and then some of the details like age and if you can get treatment, the more information, the better. Tobacco use has a huge impact as well. There's a lot of ongoing research about the impact across all cancers. We know it causes and associated with at least 12 cancers, colorectal being one of those. And there's actually ongoing research that tobacco use may even have a stronger risk factor compared to family history. So that's definitely ongoing. However, there's also other chronic diseases that affects a smaller population, but it's still really important because it increases your risk. So if you have Lynch syndrome or inflammatory bowel disease, those are 2 genetic conditions as well that greatly increase your risk for colorectal cancer. So if you have those diseases, again, your doctor is probably going to recommend that you get screened a little bit younger than 45. And again, I'm going to emphasize it over and over because it's just a few years change. 45 is the new 50. So that's where we want folks to start getting screened for. Again, this is for average risk. And I want to touch on the couple screening modalities for colorectal cancer. So if you're at average risk, you have a few tests. So You can do stool-based at-home tests. I'm sure you've seen different commercials for different brands going on. But I always like to say it's like a little science experiment that you do in your house. You basically swab your stool and you mail it off to the lab, and the lab communicates with your health system and gets back to you. So that's a really great test that you can do at home. It's very effective. The only caveat is it needs to be done every year. So that's how the screening is recommended. So a lot of people really like this test, but they forget it needs to be done every year. And then the other test is the colonoscopy, which most people are familiar with. And that one is an outpatient procedure, but you do go into the hospital for. And again, if you're at higher risk, you're probably going to need a colonoscopy versus stool-based test. Those are more recommended for average risk individuals.
And can you also share about the difference between the Fit Kit and Cologuard? I know some folks, some viewers may have heard about that other mechanism, and can you share about the differences? And then also, are there some certain challenges with folks being screened using colonoscopy that may hinder their likelihood or really their desire to seek out that particular screening?
Mm-hmm. Yeah, so they're both stool-based tests. So they're both kits that you take at home that your doctor can give you and then mail away, and then they use your DNA in the stool. So they're both very, very similar. It's just a little bit different in the mechanisms about how those tests are designed and then processed. But again, are both really great options for stool-based testing. And then, sorry, what was the latter half of that? Could you just repeat that again?
Just what are some of the challenges that you are aware of with colonoscopies, and what could community members potentially do to
Mm-hmm.
help address some of those challenges?
I would say the largest challenge that I hear about colonoscopy is um, just misunderstanding the guidelines, what that means, and then two, the prep. So part of going in for a colonoscopy is being able to clear your system so they can get a really good screening that is accurate. And so you do take what they call prep before. And again, there are different combinations now. There are more options. And so it doesn't taste that great. I have not had a colonoscopy yet, so I can't truly attest to it, but that's what I've been told, that it's not the most pleasant taste to go down. But the nice thing about a colonoscopy is if you have a clear scan, you only have to do it once every 10 years. So is it an uncomfortable experience? Yes. But I also like to say colorectal cancer screening is the only cancer screening where we can actually remove cells that we see that are abnormal before they turn into cancer. So those are often called polyps. So people are unaware of that. It's actually a screening that also prevents cancer. So I like to say that as well, and why it's just as a good option as the stool-based home test.
Wonderful. And one of the comments I hear often too is not being able to eat for a certain period of time and having to do a mandated fast
Mm-hmm.
is a deterrent uh, also. And so folks also wanted to know how to navigate that food thing with,
Yes.
you know,
I
their
will say
cravings.
I will say there's still a lot of ways to get around it. Usually it's not that long of a fast. Again, I have to follow up on those recommendations, but what I always like to say is like a little pain now, saving you a lot of pain later too. So being a little bit uncomfortable now where we could catch cancer early, or again, catch it before it even develops into cancer. I would do that over and over again.
I definitely concur with you with that. And repetition is the mother of all learning. So we can underscore if you're 45 to 75, please get checked out. Talk to your doctor if you haven't already done so, but please get screened. Now, what's also interesting about this conversation is breast cancer, at least in our state, and colorectal cancer are pretty popular, but lung cancer is not. Although lung cancer, if I understand it correctly, is the number one cancer among all cancers. And that if you add the top cancers that you highlighted earlier, lung cancer outpaces all of those combined. So can you tell us a little bit more about what's going on in the lung cancer space? What's the causes? What's the risk factors? Is there a screening to help detect it? And what can community members do?
Absolutely. So lung cancer has been one of the hardest cancers, one of the top cancers across the United States and in Indiana for many years. I don't see that changing super soon, but we're working on it. So one of those reasons is because tobacco use. I think we all understand the connection between tobacco, smoking tobacco, and lung cancer. And I've already mentioned it also causes several other cancers as well. And so in Indiana, we have a very high smoking rate. We, especially us and some of the southern states, we're in this little pact of very, very red when you look at the data. So I think it was in 2022, 16.2% of adults in Indiana smoked. And so that's, again, the largest risk factor. And the hard thing about lung cancer, again, we do have a really, really great screening mechanism, but it's really for the at-most risk population. So as you can see on the slides, adults aged 50 to 80 years are recommended for lung cancer screening, which is a CT. It's non-invasive, very quick. But you also have to have some other requirements. So you have to have a 28-pack year smoking history, and that's a calculation that your doctor will do. So that's based on how many packs you typically smoke a day over how many years you've smoked. And so that will spit out a number. So you have to meet the age requirement, the pack history, and then have quit in the last 15 years or are currently smoking still. So we definitely want to get that out there. Not as many people are aware that there actually is a screening for lung cancer. And so we're really trying to work to spread the word. But I also like to note, although tobacco causes the majority of lung cancers, it is not the only risk factor or thing that is associated with lung cancer. So exposure to secondhand smoke, we know, is also very harmful, and also exposure to radon. And so not as many people are familiar with radon, but it's a naturally occurring gas that comes out of the soil. And so there's a certain threshold that's safe, and when it's beyond that, it actually causes lung cancer. And so thankfully, we have some legislation in place that schools and buildings, apartments, they need to be tested every so often to make sure it's at safe levels. And we also have a way to reverse that. So if you're moving into a home or you do a testing kit and your house has high levels, we have remediation systems, and many health departments across the state actually offer testing kits for free as well. So I always like to put that on folks' radar as well, that it is also a cause of lung cancer after tobacco use. That's the second leading cause. And so we really focus on tobacco and have some work to do, because that is the main contributor for the numbers in our state and for Hoosiers suffering.
Wonderful. Thank you for sharing that. And can you talk a little bit more about the COE's interventions that we're employing to address this issue, the Get Screened campaign, the lung cancer risk assessment, as well as our partnership in Lung Cancer Now?
Yes, because it's the #1 cancer, we have lots of initiatives that we're trying to tackle this burden. So our first being for National Lung Cancer Screening Day, we partner with the American Cancer Society, the Indiana Cancer Consortium, and Lung Cancer Now, and other leading cancer organizations in the state. And so that happens, it's the second Saturday in November. So this year it's going to be November 9th. And so what we do is we provide technical assistance and awareness to health systems and individuals to get screened. So this is a Saturday, and we work with health systems to open their screening centers on Saturdays to alleviate that barrier of having to take time off work to get screened. And we work with some health systems to either provide free screenings or lower cost screenings. And then we work with those leading organizations as well to do public education campaigns with social media, in person as well, to raise the awareness among individuals to advocate for themselves. So that's one initiative. We did it last year. We had 26 centers participate, over 150 individuals screened. This year, we're already getting started, and we're going to have many, many more. And in addition to that, we partner with Lung Cancer Now to create a lung cancer risk assessment. And what we do with that is we go to a lot of community events or community partners. And when we're talking to them about lung cancer, we do individual risk assessments. It's a red cap survey, and letting them know if they're at increased risk for lung cancer, mainly focusing on that tobacco use habit. And then also if they meet the screening recommendations, if they're eligible to that. And if we find that they are, we're letting them know that they're eligible, that they should talk to their doctor about getting screened. And then we also just help navigate them to how you find screening centers, your primary care provider, and so on.
Wonderful. Thank you for sharing. I will also say we are also providing funding support in lung cancer now to develop a more robust lung cancer risk assessment that will go statewide here once they have developed it. And so we're very excited about partnering with them and getting the word out and helping people to identify where they are in that continuum and getting connected to care. So thank you for all the great work that you are leading to do. And then we give a shout out to Mackenzie and her team at In Lung Cancer Now for the partnership. And so just as you did with lung cancer, can you also talk about HPV? I know that's a little different than the other ones because it's not just one cancer, but it's a grouping of cancer which the human papillomavirus may impact and cause some abnormal growth. Can you talk to us about what that is and give us a rundown as you did with some of the other cancers?
Yes, HPV stands for human papillomavirus, and it is a very, very common virus. It has many strains, and so some of those strains are, harmless. They'll go in your body, out of your body. Your immune system will clear it, around 2 years, and you'll never know. And then there's other strains that causes diseases such as genital warts and cancer. So as you can see the little chart on the screen, HPV actually causes 6 different types of cancer. And then you can see the percentages that they cause. So specifically, if you're looking at oral cancer, 70% of oral cancers are caused by this single HPV infection. And so we want to raise awareness about it because it's extremely common. As you can see, 85% of people are going to be infected in their lifetime. When you look around a room, I think over 42 million are infected, another 13 million are infected each year. So again, extremely common, and there's some really safe strains and some really unsafe strains. So we like to increase the awareness for folks about this virus as well. But we have a plus side. So we have a vaccine for HPV. So I don't want to bring you down with some bad news. I have some great news as well. This is the only cancer prevention vaccine that we have that addresses this many cancers. So like I said, with there's many strains, this completely addresses those strains that causes cancer. And so it's approved for folks from beginning at 9 years to 45 years. And the ideal range is 9 to 14 years. And it's going to be a 2-dose series, and you're getting those 6 months apart. Now, we call it catch-up vaccination if you're a little bit older because you need a 3-dose series. And the main reason for that is research has shown us that those that get it at a younger age, their immune system has a stronger response to it, and you have a higher rate of protection. And when you get to 27 to 45 years old, that's where we talk about there should be some shared decision making with your doctor if you should receive the vaccine or not. And that is mainly because what I like to say is HPV vaccination is a prevention vaccine. It is not a treatment for HPV. So once you're already infected, this vaccine can't do anything for you. Your immune system's already been exposed. But if you can get the vaccination before you've ever had exposure to it, you're protected. So again, we want to get it when they're younger, when their immune system has the strongest response. And then I just wanted to dive into 2 of those HPV-related cancers that Hoosiers are really being affected by, and that is head and neck cancer. And so again, I'm going to throw that HPV causes 70% of them. So if we could really raise our vaccination rates among our young boys and young adult men, we could really reduce what we're seeing. Again, some of those modifiable factors, such as using tobacco and alcohol, also increase your risk. And then I wanted to put gender on there as well. Specifically in Indiana, we're seeing a really large increase in white males being diagnosed with oropharyngeal cancer. So if you can see, I know that image is a little bit small, but on the left, there's a little dotted box. All of those cancers are included in the oropharyngeal sites, which HPV is the cause for. So always like to put that out there to pay special attention, especially cancers like this where we don't have like screenings like we do for mammograms, whether it's a mammogram, a CT, an X-ray. That is not the screening modality for HPV-related cancers of the throat and mouth. So I always say, listen to yourself. If you know your body best, if you're feeling something different, if you're feeling bumps, make sure to see your doctor. And also at your dentist visit, you should be going every 6 months for your regular cleaning and checkup. They should also be doing a physical exam as well, looking in your mouth and throat, as well as feeling along your jawline and your lymph nodes as well. And then the other one I wanted to talk about that's associated with HPV is cervical cancer. So about 90% of cervical cancers are caused by HPV. So we always like to say this is the one cancer we're really confident at this time that we could eliminate because we know what causes the majority of it. We have a very accessible vaccine, a very low cost vaccine. And so we really, really want to get that information out there about how much protection you can get. And again, if you can never have yourself or your children worry about getting some cancers, we have enough to worry about in the world. So why don't we just take that worry away? Some of the other risk factors is also being diagnosed with HIV, just because that lowers your immune response, your immune system's ability to fight other diseases. And again, you're going to see tobacco use. Now, tobacco probably causes a lot more diseases than we know about, but these ones that I specifically mentioned, we know have a very strong association. And then there's a few reproductive factors that'll slightly increase your risk as well. So if you've been on hormonal birth control for over 5 years, if you have more than 3 kids, that slightly increases your risk as well. But and having multiple sexual partners, because again, then you have a higher risk of the HIV and HPV infection. So we have really good screening, a really good vaccine. So we want to make sure we're on top of that. And basically at age 21, if you're a female, then you need to be starting to get screened with a pap smear. And that can happen in your primary care provider's office or at the OBGYN as well. And so they'll intertwine them with HPV testing as well, with the screening ages that you can see on the screen.
Wonderful. Can you share some of the programs and initiatives that COE is involved, like the Rural Health Project?
Yeah, so we're partnering with the Indiana Immunization Coalition and several other partners throughout the state to really work in some rural northern counties where we're seeing have low vaccination rates and high cancer incidence. So there's many pillars to the project, but one of those being really intentional health fairs with providing services at those health fairs, getting any type of screenings we can done for not only cancers, but those other social determinants of health. So I know we've done 2 rounds, and I think I don't have the final numbers, but I know we've had over 700 in attendance. I think we're probably around the 400 mark for vaccinations. So it's really had a great impact and been a good partnership.
This is great information. Can you share for those who, they're thinking about, well, what can I do to prevent, or what can I do just in general to really decrease my likelihood for getting cancer? Can you share some tips that folks could walk away with to consider for their health and well-being in the future?
Definitely. I think that the number one easy thing to do is definitely get screened, follow those recommendations, because when you catch cancer early, you have a much better treatment, more effective treatment. You're going to have a better quality of life, lower costs, and often lower longevity of treatment. So we really want to focus on that. I know people sometimes are saying, I don't want to get screened. I don't want to know. There's natural fear of cancer, right? But actually, you're going to know one way or the other. You're going to know when you get early, when you diagnose, or if you're waiting, you're not getting screened, you might be getting diagnosed at a later stage and have lesser options. So I always like to say, get screened on the early side. Now, the other ones are easy recommendations, hard to implement, right? Because we have to think about society, our social groups, how these things are part of our culture. So when we think about nutrition, as we all know and have been preached at, eating more whole food, less processed, reduce our sodium. Those are all great things to keep us at a healthful weight, keep our other chronic diseases that also increase the risk for cancer, like cardiovascular disease, at bay, and also keep us at a healthful weight. So obesity is associated with 13 different types of cancer. So in general, trying to make really balanced meals, having our treats and processed food in a balanced amount is important. But what I will say is we do have 2 food groups that are known carcinogens, and one of those being processed meat. So I know I personally love my turkey sandwiches, your Italian subs, all things like that, sadly, are processed meat and absolutely are associated with causing colorectal cancer. So not so much fun, but there are really other great options that we could dive into, like rotisserie chicken and such you can make sandwiches out of. And then the other one is really reducing your alcohol consumption. So the CDC really advises that the less alcohol you intake, the lower your cancer risk is going to be, since it is a known carcinogen and damages your DNA. And so those are the two top ones I'm going to recommend. And then again, we have a lot of great services like the Indiana Quit Line, which is a free program to help people quit at whatever stage they're at, whether they're still thinking about it, they're not really ready, or they're definitely ready to quit, and you can get with a coach. And again, that's a free service. And then I always get asked when I'm in the community and I'm talking about screenings, where and how much, right? So I'm telling you the information you need to know, but how do you then act on that? So most of your screenings are going to be facilitated by your primary care provider and either get you that referral, help set up their appointment, that office can. If you have insurance but don't have a primary care provider, you can go on their website and find someone that's in network. With insurance, these are all preventative screenings and cost zero to the patient. They are 100% covered. Now, if you don't have insurance, we have some really great programs in the state, like the Indiana Breast and Cervical Cancer Program, which provides free screenings for those underinsured and uninsured. So I always like to make a plug for them. They have a really great website with local coordinators that you can get in touch with. And then in terms of vaccinations, especially for HPV, you can get them through your primary care provider at your yearly checkups for your children or yourself. The local health department usually always has them as well. And if you don't have insurance, they usually can cut the cost and either provide it for free or low cost, around $15 to $25 is what I've heard. And then your pharmacies as well, all your local pharmacies will provide those, and then also mobile clinics. So a lot of health systems throughout the state provide mobile clinics, have their own health fairs, as well as the Indiana Immunization Coalition goes throughout the state with their mobile clinic as well. So we have lots of access points.
Wonderful. Thank you for sharing all this wonderful, great information. Now, we highlighted some of the major cancers in which people are impacted, and we highlighted what they were, what screenings and risk factors are associated with them, and then where they can get connected with services. Are there other cancers that fall into this category of being preventable and or being able to be detected early?
Yeah, there's definitely more cancers that should be on a radar and be aware of. And again, a lot of these risk factors to prevent the cancers we talked about today will also prevent other cancers as well. So I really encourage you to go to a cancer center's website. It's cancer.iu.edu/race to beat cancer. And this is a screenshot of that page. There's more information about some of the other cancers that are really common in our state, such as skin cancer.
Wonderful. This has been just wonderful information for community members to really know to help influence their health and well-being. And so what we're going to do, Mary and I, are going to answer some of the questions that were submitted during the registration process in advance. And so we'll entertain those questions now. And so one of the questions are, can you share success stories from the COE's outreach and promoting cancer prevention?
Yeah, I think I mentioned a few of them, especially with our HPV partnerships. Another example of that is we actually go to events that are targeting families and children, so our, like a back to school events, and what we will solely focus on those events is talking with parents about kind of what I said to you, the HPV pitch, how important it is, and then we also make sure that a medical provider is there to actually provide those screenings on site. So we're really reducing that barrier and that decision, because a lot of times we have conversations and they said, oh, my son is 10 years old, he's eligible, and let's get vaccinated. And then they can get that done today. They can follow up with the second dose with some of their other providers. So that's some of the HPV work. We also have some, like the lung cancer risk assessment. We have a colorectal cancer risk assessment that we employ the same way in the community. So people know their status, know their screening options, and know how to act on them and be an advocate for yourself.
Wonderful. I know that we touched upon colorectal cancer earlier, but we didn't share about the risk assessment tool. Can you share more about that and how we're implementing that tool here locally and across the state?
Yeah, we have a partnership with a lot of local organizations, one of those being the Indianapolis Urban League. And what we do is depending on the setting and the partner, we really tailor it. But in this case, we provide a presentation, and then we have individual conversations with folks that are there. And again, this is during some of their programming. And the risk assessment really goes over those specific risk factors that we talked about: family history, tobacco use, have you been screened before, and some of those other genetic diseases. And so they really get down to know, are they at increased risk or are they at average risk? And then from there, what are their screening options? So what is it can be a colonoscopy, a stool-based test, or some of the other options as well. And so we really let people know where they stand, their status, and hopefully they feel empowered to take action and get screened.
Wonderful. And I will just share, a few other initiatives that we're doing across the state. One, we have an American Indian health initiative where we partner with the American Indian Center of Indiana. We also partner with the Native Commission on Native American Affairs, the Pokagon tribe, as well as Purdue University and Notre Dame. And we're implementing a adult tobacco survey to assess the needs of Native communities throughout our state, with the purpose of customizing a program to address their needs. Unfortunately, there's not anything specific for the Native American population, although they are one of the highest populations that are engaging in commercial tobacco use. And we have to differentiate because their traditional form of tobacco use is different than the commercial use. And so we really are aiming at that. And so we're having that actively going on right now. We're also partnering with Fort Wayne Pride to also look at tobacco use within the LGBTQ population. When you look at the statistics, that is the highest smoking group. And so what we're trying to do is come alongside and see what type of messaging that we can get out to encourage a tobacco cessation, also to empower partners to take part in our tobacco treatment specialist program, which helps to empower partners and providers to use motivational techniques to help people quit smoking in conjunction with the quit line, other types of interventions that are being employed. So those are a couple of the highlights and of other groups that we are working to address here in our state. Didn't know, Mary, if there's any last comments that you want to share as time is beginning to wind down in terms of some of the interventions or partnerships and what we may be doing that people may want to know about or learn about. And I would just love to just for you to share your thoughts about that.
Absolutely. And I want to know, as you said, time is winding down. So if you have any more questions to submit before we close, please put them in the box and we'll try to address them with our last few minutes and submit them in the comment box. I think that just a couple other initiatives I'll mention, especially around HPV, is HPV can actually happen in a lot of different settings. So with the COVID expansion and pharmacists being able to administer vaccines themselves, they're also a great access point. We've also partnered with dental associations and county health departments to train dental providers in the state as well, because they're asking about oral health in general, but sometimes they're asking about tobacco use already because of the effects on the mouth. So we're trying to help raise their awareness about their impact and how they can be a champion for HPV vaccination. And then in some clinics, how they can actually vaccine on site, especially those that are SQHCs and have both the dental and medical providers on site. So we do a lot of trainings with professionals as well, motivational interviewing. So we have both internal, external programs, and really everything we do is through partnerships, not trying to reinvent the wheel.
And I will also say we were remiss if we didn't put a shout out that we're available as an office, that if you're engaged in research efforts or you're interested in research efforts, we're the bridge. And so we try to connect the community with academics with the community to help do a deeper dive in some of these cancer issues. And so if that is something that is of interest to you, please reach out to us so that we can help make the connections. So we help with recruitment, we help with just design and messaging. And so if there's things that we can help you in your work, we help to identify experts here at the Cancer Center that can come out to the community and provide talks on any variety of these issues that we highlighted. So please feel free to reach out to us. We are wrapping up now, so we want to thank you for joining us for this month's Simon Says. You can find a recording of today's session and information about upcoming sessions at cancer.iu.edu/Simon Says. Thank you for joining us. We wish you have a great, wonderful, and prosperous day.